Today, friends, we'll be talking about the procedure for hip replacement for our patients who are coming from Africa. Hello, friends. My name is Dr. Sharma, and I am joint replacement surgeon in Delhi, India, and NCR region. Today, friends, we'll be talking about the procedure for hip replacement for our patients who are coming from Africa. Many of our patients have questions who are coming from Africa and other countries that what will be the procedure, what will we do, and how we will do it, and how you will go back to the country. So, friends, we are having our WhatsApp facilities on which you can book a primary consult and you can send your x-rays to us on the WhatsApp, and then we will direct you to where you have to come and what all options are there for you. In hip replacement, we have advanced things like MIS technique, in which we are using the direct anterior approach, which is the true MIS technique, which is the muscle sparing approach, in which you have better recovery, early recovery, you have no restrictions on your hip, and the precautions are very less, and the dislocation rate is negligible. We are now using high quality implants like oxenium and ceramic implants, which are uncemented, bone gets incorporated in them, and they are very high performance implants. You will not be restricted on doing anything in your life. So when you send your x-rays, we will go through them and tell you what is required. If it is required on one side or on the other side or on both sides of the hip joints, which implants you want, and then we will send you a letter of invitation which you can show to the embassy. You can come to us, you can choose a city. We prefer operating in Delhi, which is the capital of India, and also nearby cities like Noida and Agra. These three cities have different cost of the hospitals. It depends on very high 5-star hospitals, which we will make you available in your preferred city, and you can avail all the 5-star facilities at these hospitals. Next thing which comes is the choice of implants. There are a lot of implants available, maybe cemented, imported, local, metal or ceramic implants, which we can use for hemi replacement and total hip replacement, and different techniques. We usually prefer the MIS technique, and in MIS we prefer the direct anterior approach, which is the true MIS technique. Usually if we are operating on one hip, the stay required in the hospital is about 3 days. If we are doing a both hip replacement at single sitting, then it may require from 5 to 7 days. The stitches we remove after 15 days. We will help you find local stays if you don't want to stay at the hospital, so that it is cheaper for you. Next important thing is the rehab. Rehab physiotherapy started on day 1. You will start walking on day 1 with support, and it depends on your confidence and your weight and the type of surgery. Usually we make all our patients walk within few hours of the surgery. You will not require to come for follow-ups from your country. We will have video consultations after you fly back. You can even fly back in 3 to 5 days, or you can stay here till your stitch removal. Now next thing big comes is the cost of the surgery. The cost may vary a lot depending upon the quality of the hospital, whether it is a medium quality hospital, whether it is a 5-star hospital. Second, the cost will depend on the technique, whether we do it with the traditional technique, which has few limitations, or with the MIS advanced technique. And main is the implant quality. If we're going for imported ceramic implants, it will be higher. If we are going for medium quality imported implants, it will be lower. So if you have any queries, you can WhatsApp us on the given numbers below, and we will help you in all sorts of formats which we can. Thank you so much.